you, Sally, and the Healthcare the Future for inviting me. I'm a doctor. I don't practice as a doctor now. Excuse me. I qualified in 1983 from St Mary's Hospital, where Professor Fleming accidentally discovered penicillin by not tidying his laboratory up properly. And I have been practicing in the health service for more than 40 years, and I was an NHS GP until 2020. I used to practice homeopathy and naturopathy, as well as doing working in the NHS, but I stopped doing that after I was told by a senior official that if on questioning whether if there was a conflict between the NHS policy and the best interest of the patient, did one have to follow NHS policy? And the answer was yes, if you want to work in the NHS. So yeah, so I decided that's not what I signed up for. So I carry on doing my private work, which was not medicine in terms of prescribing these types of drugs and so on anyway. So I continue to do that, and I have other interesting history with the General Medical Council, which you can look up on my website. So I'm here today to talk about mental health and the things we can do in terms of diet and other interventions. And so I'm going to share my screen now. I've known Sally for many, many years. I first met her over 20 years ago when she actually became maybe it's almost 30 years, when she became a patient or in the practice that I worked at in the NHS. So there you go, we go back a long way. So I'm going to share my screen now. Oh, good, here we go. And we're going to look at mental health. It's something that is really important, and for many of us it can be a very difficult thing that happens when our young people become teenagers and young adults, and we feel very stuck in terms of how we can help them. And in terms of psychiatry, it's a very reductionist profession, and the only treatment modalities, although lip service is given to some forms of counselling, is drugs. And the drugs are not satisfactory because they don't cure the cause, they just mask some of the symptoms. And you end up, if you have a quite difficult situation, having your original problem smouldering away underneath, just barely contained by the medications you are taking, and then having the problem of the effects, the undesirable effects that these medications have on your psyche itself and your body, and in terms of addiction and so on. So we're going to look at mental health and what people can do themselves for themselves, and if they find themselves in these conditions. Now, one of the things that's interesting is if you look for images about mental health, I hope you can all see this, by the way, you get lots of pictures of brains. Some are prettier than the other ones. You can see one of these ones here has got a normal brain, a scrambled brain, a brain with a heart, a brain with lots of flowers, because we tend to think that mental health is in your brain. And certainly that's where the psychiatric pharmaceutical industry puts all its efforts. Although there is a new concept that's coming around in pharmaceutical technology called beyond the pill, which I think is supposed to be something about having a nice life as well. So where is mental health? Is it in your brain? Well, as we learn more and more about the gut and the brain, we find out that actually there's a very big link between the gut and the brain. And a lot of this is channeled up the vagus nerve. And in some situations, we have to ask ourselves, really, we talk about the gut brain, you know, we know about that. I felt it in my guts. It was my gut feeling. And I must tell you, as I get older and older, and I learn more about different types of life, politics, philosophy, religion, healing methods, I realized two things. One, that is what we know is so small compared to what we don't know. I think I said this on Wednesday, that it behoves us all to be a little bit humble about what we are dogmatic about, because we don't really know much at all. And the other thing is, if there's ever a conflict between what your gut says and what your head says, the gut is always right, because it doesn't get taken in by these false sophisticated arguments that the head gets swayed by, including group pressure. The gut feeling is a lot older, and it protects you, and it's there to help you in the most urgent of circumstances, and you always need to listen to it. So there is a gut brain. It has a big effect on your brain. And as we've gone further along the path, we found that not only is the gut really influential in terms of influencing our brain as opposed to the other way around? But actually the gut microbes, of which we apparently have about 2.5 kilos in our body, without which we couldn't survive. I blame excessive gut microbes whenever I stand on the scales and it's higher than it ought to be. We have gut microbes, and it's possible that because they have such an effect on our gut that we don't really know whether it's our brain controlling us or the microbes controlling us. It wouldn't be too fantastic an idea, because the microbes have certainly been around a lot longer than we have, and they're very, very successful creatures. So in terms of mental health, where is it? Well, it's not in your brain. That's not where mental health is. It's not just in your gut either. So definitely it's a big window opener to have an understanding of the gut-brain connection, and the fact that the microbes and the microbiotic health in our guts can make a big difference to how we feel. But I'd like to suggest that actually where our mental health is actually in our heart. Why do I suggest this? Well, I think that we throw away ancient knowledge at our peril, and the heart has always been seen as the seat of the emotions. It's also the center of our chest. It's very near the solar plexus. And if you think about mental health being to do with your brain and your gut, you can see it's the highway, it's the pathway in the middle. That's our center point. And of course, there is a difference between the actual anatomical heart and the emotional heart. The anatomical heart is a bit to the left and down on one's own body, but the emotional heart is right there in the middle. And and I'm making this point because it's really important to understand how many things you can do that actually affect this emotional heart, where your real mental health is. Because when people get stuck in these situations, they often fall between, am I going to take all the drugs? Can I get the psychiatrist to see me? Can I get the psychologist to see me? What about all these herbs and everything that I can take? But the fact is that there are many, many things that you can do which don't involve any of these decisions, but have a direct effect on our heart, our emotional center. And one of the people who I find is very inspiring in terms of mental health is the great late lamented Dr. Abraham Hoffer, Canadian, born in Saskatchewan. And he lived a nice long time, which I always think is a good sign. If you're into holistic health, it's always a good sign if you live to be quite old. He was 91 when he died. And he saw the changes. He qualified as a doctor after having already qualified in many other professions, scientific ones, in 1949, and he was still practicing in 2006 or 7. He was writing books then. He was a really, as I said, he was an amazing man, a great thinker. And he saw what the mental hospitals were like up until the 1950s, which were just places to cargo people. They put them inside and they were never expected to come out, and the conditions were dreadful. And then the drugs came along, and they were the great panacea. And then they cured everybody, meaning basically they shut them up so you couldn't notice they had any symptoms, and then they got chucked out. And he points to what he sees as 3 of the top things that you need, which he also adds supplements, because he's an orthomolecular, which is a bit like a naturopathic physician as well. And he said that the first, not first, but there are 4 things, and they're all equal. And one of them is you need shelter. Another one is you need care. Another one is you need nutrition. And then you need some extra supplements to help you. So in the 1850s, the Quakers were the first people who made very humane establishments to put people with mental health problems. In other times, they had been stuck in dungeons. We know the stories of Bedlam, which was the Bethlehem Hospital, that people were chained to trees in forests and left there. So they decided that being humane would be nice. So they did the first of the 2 things. They did shelter, and they cared for these people, and they spoke to them nicely, even if they were quite difficult. And they also gave them food, which, however good or bad it was, had more whole food in it than the almost unrecognizable as food now that we have, which is so severely processed that many of the nutrients obviously all come out and they're put back artificially, because there's nothing left much of the original thing. So in just providing shelter and care, and the care includes sort of decency and kindness, about 50% of these people would naturally resolve their problems. There were no drugs in the 1850s for these problems. And so when parents they were talking about what we now call schizophrenia. And all of these things are a continuum. And so sometimes when parents get into have this awful problem with something that often comes along in teenage times, which used to be called hebephrenia. Hebe was one of the daughters of Zeus and Hera. She's the goddess of youth, and Evie is Greek for puberty. And she was very beautiful. And this hebephrenia, the phrenia bit meaning to do with your brain. But in all these languages, the brain also means the feelings and the heart. And actually in Greek, ta phrena are the brakes on your car. So they need to know that with so this used to come on when you were a teenager, and many people would grow out of it. And now when you look at psychiatric books and you look up hebephrenia, which is Heb, Hebe, like the plant, and then phrenia, Phrenia, you see it's one of the complex diagnoses of schizophrenia. It's one of the 5 types, and it talks about disintegrational personality, and the whole thing looks exceedingly grim. But in fact, hebephrenia was a good description of something that would often come on when people were approaching post being a teenager, puberty, because those hormones have a big effect on our mind, and there's lots of brain selection going on at those times. And it was generally regarded as something that you would grow out of. And this lack of knowledge of this fact that people can grow out of these things, and 50% of these things can just recede without any of what we call treatment. Sometimes patients say to me, "Oh, my daughter had a fever and I didn't do anything and she's fine." And I say, "I presume I didn't do anything meant you didn't give her paracetamol and ibuprofen, but you did nurse her, open the window, give her lots of fluids, and etc." "Oh," she said, "yes, I did all of that." I said, "Well, that's not nothing. Doing something that's not pharmacological is not nothing. In fact, it's what we really need." So without any pharmacological interventions, you can make an enormous difference on someone who is suffering their mental health by giving them shelter. If they're your child, they'll generally be in your house. And care. Well, care is a bit difficult actually sometimes, because if it is one of your own children, it's very hard because we're locked in this relationship with them as well. And I don't know if any of you who have children ever remember, maybe you never did it, but being really pleased you'd managed to get one over you'd won the argument with a 3-year-old. And then you step back and ask yourself, "I'm really pleased I won an argument with a 3-year-old. That is so ridiculous. There must be better ways of doing this." As we are part of the problem sometimes, or the toxic relationship we might have deviated into is part of the problem. It's quite sometimes hard to give the care that we need and speak the right way. And also giving care and being civil and decent, which is what people need to have in government institutions as well, which for a long time was sadly lacking. Is, as I said, doesn't mean the same as you should be a complete doormat and just let everybody do everything and not give anybody boundaries. So you're in this difficult situation of trying to give boundaries, trying to be fair, trying to not be a doormat, because that doesn't help anyone. As we know, in many types of mental health in America, they were pushing it was the just say no, but you can do all that with care, civility and decency. And as I said, just to know that doing that can make an enormous difference, and you will get through things. One of the things that people sometimes find when they're in these emergency or chronic situations is the idea that whatever they're doing, if they don't want to go down the drug route or the continual drug route, is that really, and often relatives think this, if you just did what everybody else did, they'd be better by now. And so you need to realize that the alternative of not necessarily taking very strong psychiatric drugs is not, "Oh, I'll stick with this and it will be really long and it will be really difficult for our family and we could have just fixed it up in 2 seconds if we'd taken the drugs." There are so many people who are completely damaged by the drugs. They're in institutions for a long time, or they're in institutions for not long enough, but the institutions aren't suitable. And just about every study that you look at in terms of any type of psychosis, which is the most difficult thing to manage, is show that the ones who go off the drugs are the ones who have long-term better outcomes. And those major tranquilizers and other drugs that we give that are newer, they do have an effect on the grey matter of our brain, and it's a bad effect. And even the nice guidelines say this and say you should be very careful before you put people on these things. But this doesn't seem to stop the runaway chariot of people just being given another and another and another. And you can see that when somebody's on 3 or 4 different types of heavy, slightly different group psychiatric drugs, that the drugs are not a panacea. They're not a magic wand, and it doesn't make it any quicker. And if they are on any of these things, all these other things you can do will make the situation improved anyway. So there's never a waste of time in doing them. So those are the things that 50% of people in the 1850s would get better from. After a while, it didn't work anymore because the places got overcrowded and there was no care, civility or decency and so on. So let's look at nutrition. Now, there are studies, for example, recent study in Australia looking at the Mediterranean diet and showing how that improved people's mental health compared to people who didn't have it with no other interventions. And when we go on a bit further, you'll see why the Mediterranean diet might help. But one of the things Dr. Hoffer's quite careful to mention, and it is true, is that there is no panacea diet. There's no one diet that's going to be the right one for everyone, because everybody's got different genetics, they've got different traditions, they've got different things that they were adapted to over centuries. So the Mediterranean diet, which most of the pictures you see, that's the middle one you've got here with the fish and the berries and so on and so forth. They never seem to put much meat there, but I don't know if any of you have been to the Mediterranean, but certainly in Greece, they like eating their roast lamb, which is nice and fresh and has been grazing on their Arcadian hills. But then if you are a person who grew up on, roast beef, Yorkshire pudding, whatever, decent vegetables, you'll see when you look into nutrition and you look at, for example, non-animal sources of vitamin A, which are these green leafy and orange vegetables, you'll see that the best way of absorbing the non-animal forms of vitamin A, so it actually becomes useful in your body, is with saturated fat. And here you see a plate that's got, if the gravy's proper as opposed to out of a box, they'll have used the saturated fat from whatever the meat produced when it was roasting to make proper gravy, which will make the absorption of those carrots and green leafy vegetable vitamin A better. And then if you cast your mind back to before the 1970s, when we were told that saturated fat was very bad for you, no one would serve up carrots unless they were vegan without a knob of butter, big knob of butter on top of it. But then if you try and make somebody eat the Mediterranean diet whose tradition is from the Indian subcontinent, it's all very well saying that, but if you look at people who say you should eat what you have locally, you'll find a lot of these things are not local, especially if you're inland, and they have a much more pulse-based diet, but they have colourful food and colourful vegetables. Then again, if you're an Inuit, and before Inuit started Western diets, as the traders brought them, white flour and white sugar and so on and so forth, and they ate mostly meat and fish, a lot of it raw, in situations where and frozen. So they didn't actually cook meat unless it was a day's journey from where they'd caught it, because they thought it was better to eat it fresh. And they couldn't grow any vegetables, and although they could gather berries and things, that was only for a very few months of the year, and yet they have very low incidence of heart disease. And people who write about the cholesterol hypothesis point this out. And then you have people in African countries like Kenya, the Maasai, who one of their traditional ways of living was milk, meat and blood. Here's somebody pouring some blood out that they've got from the neck of a cow to drink, you see. So there is no panacea diet. You have to look at the person themselves and see what they respond best to. And you also have to look at how they've adapted over the years. So, and if you were stuck on the Mediterranean diet would be good. And I think one of the reasons actually in some of these studies, which are generally always quite small in numbers, that people improve is, well, if somebody's going to send you a crate of the right food to eat, having sent you to a workshop to teach you how to cook it, you're going to be eating more vegetables and less processed food anyway, which is always good for us. We need the vegetables for bowel health. So then we come to, so we'll talk about some supplements now. So this is not, Dr. Hoffer doesn't mention vitamin D. He talks about vitamin C and others. But from my own practice, which has been going on for many years now, I think of vitamin D deficiency as the great pretender. Whatever people come with, whether it's depression, hair loss, irregular periods, celiac disease, joint pain, whatever they come with, until I know that their vitamin D level is 120 to 150 nanomoles per litre, which those are the British units. If you're abroad or you have American leanings, it's 40 to 60 nanograms per litre. Unless I know that they're up there, I don't know how much of all of those symptoms are caused by the low vitamin D level. So in the UK, the range is 50 to 250. And if you're lucky enough to get your doctor to measure it and it's 47 or 50, they'll say, great. But of course, it's not great, because below 50 is deficient, and not having rickets is not the same as being healthy. And certainly with the whole COVID situation, my patients who all had levels up to 120, between 120 and 150, they did very well indeed. So vitamin D is really important. I've got some pictures of vitamin D containing foods along here. There's eggs, butter, liver, mushrooms, so on. And of course, sunshine, which I haven't got a picture of. And people say, well, I walk, I go out every day in the sun. Well, we don't have that much sun in the UK, and you really have to not have many clothes on if you're going to be going out in the sun and make it count for vitamin D. So of course it does, but you need to do more than that. And then I've got some pictures here of vitamin C, which Dr. Hoffer does mention. Now, one of the things about vitamin D that's really important is that it's fat soluble. I mentioned this on Wednesday. You have to have a good gut, which means you have to have not low-grade inflammation or high-grade or medium-grade inflammation, and you need to have a good gut biome to absorb fat. So if you, in a situation when you're trying to get someone to optimal nutrients and optimal health, you need to make sure you've got them at the right levels. So I recommend sprays. Obviously, if you get your blood level tested and you are 120 to 150, that's fine. It's almost never, in my experience, of people testing. And if you've got your teenager who's not that well and you don't particularly want to be sticking needles in them, I would assume to myself that they were low and get them some kind of spray. When talking about these interventions, you have to also be aware that they might not be wanting to do any of the things that you want them to do, which can make it slightly more difficult. And so there's only certain things they'll tolerate, but they might tolerate a spray. In terms of vitamin C, we don't make it ourselves. If we were a rat, which is a successful animal of our size, if the rat were our size, they'd be making 4 grams a day. And so I think the minimum people need is 2 grams twice a day if they are of an adult size or weight. And that's just as a standard for everyone. And if you've got a difficult situation, you might want to try and make more. And slow release is an easier way of keeping the vitamin C levels higher. And obviously in putting in the diet the foods that do include vitamin C, but you have to remember that with things like oranges, it's the skin that's got the most vitamin C. So if you have a juicer, excuse me, you want one that doesn't discard everything else. So that's 2 things, vitamin D and vitamin C. Now here we have Dr. Hoffer again here. He has there's a book here all about niacin, which I'm going to talk about. He's got this fascinating book about psychiatry, and which I can give you a link to, and some other links and information in the resources. And this is where he tells you about what psychiatry was like, what it's like now, and what he did. And if you look up his Wikipedia page, it says none of this is scientifically proven, but he has so many commendations by people. And in fact, if you look at niacin, I think on one of the drug websites, the official drug websites, there's an enormous testimony of people with psychiatric problems who've taken niacin who have been helped a lot. He particularly looked at schizophrenia, but it makes a difference in anxiety, lack of sleep, and depression as well. And there's an actual book called Niacin, The Real Story. But if you're going to buy one of the two, get the psychiatry one. When it comes to things like dosages, what I normally suggest that people do, because I work in partnership with people, some things I will say, yes, this is your vitamin D level. This is what you need to take. This is the vitamin C level. This is what you need to do. There are other ones where you need to do some reading yourself. So when I'm talking about niacin, I say, look, you need to get, but ideally both of these books, have a read of them, get yourself on board, decide what you think. Okay. If you can get your team, because some people with mental health problems are able to understand they need to help themselves, and some are just not approachable at all. But some people do want to read or be read to. So those are 2 books. And then people that then can work, as I said, in partnership with deciding what doses they want to use. So he recommends, in terms of vitamins, that you need niacin. That's the main one. generally in doses of about 1.5 to 3 milligrams a day. Here's the niacin containing food, here's the pyridoxine containing food, and here's folic acid containing foods. And you can see a lot of these foods look pretty similar. And you can see a lot of these foods would be in a good diet, and they'd also be in a Mediterranean diet, which can definitely help your health with all that olive oil as well and other sorts of oils, but they need to be cold pressed if you're going to get the essential oils from them. But as I said, it's not a panacea for everyone because it partly depends on what you're like yourself. So he recommends, the niacin is the mainstay, but he also recommends pyridoxine and folic acid. And you can get some pretty good B complexes. You can also get brewer's yeast. But you usually find when you're doing these for therapeutic reasons that you need to actually get separate ones to put them together for that. And then when you've got over your crisis, because often when you're going through these things, you realize that you might have got into these situations because of being chronically low. And your body's actually quite good at telling you, if you're chronically low in B complex vitamins and you take a high dose, like the Solgar 100 high dose vitamin B complex, maybe after a year of taking it, your body will go, yuck, I don't want that anymore. Always listen to your body. Don't say, no, you have to have it because that's what's made you healthy, whatever. If the body's saying, no, I don't want that anymore, could be you're topped up now and you just need to wait a bit. So his mainstay is niacin, which you'll see looking at his book, which I give you the details of in the resources. And he also, in terms of minerals, thinks that you need zinc, copper and manganese. There's a lot of liver here, you can see, and there's liver in the vitamin D too. And so a lot of these constituents are present in diets of people who are not vegan or vegetarian, but there are vegan and vegetarian ways of getting them, but you have to work a lot harder to do that. And in terms of vitamin D, really you have to take vitamin D and B12 supplements if you're vegan, because you can't get them properly unless, as I said, you spend all day naked in a sunny country. It's not going to happen. So these are ones, and you generally have to get them separately. They're in multivitamin supplements, but whenever you have multivitamins, they're just really to give you trace elements, because if you actually want substantial amounts of these things, you have to address them separately, which is part of what you do when you're going on your journey. So in terms of diet, also omega-3s are very important, and they're in lots of nut and other sorts of food. They're in safflower oil, and they're very useful for brain function. However, with all these oils, if you want to get the important ingredients out of them, they need to be cold pressed and then use them as salad oil, because if you start cooking with them, these are all polyunsaturated oils, which we were told were the things that were going to save us from heart disease forever, unlike ghastly saturated fat, which was going to clog up your arteries and make you have a heart attack and a stroke and die young. But actually what happens when you cook these polyunsaturated oils is that the polyunsaturated bonds ping open and produce lots and lots of free oxide radicals, otherwise known as reactive oxygen species, which are like, as I mentioned, somebody with a blowtorch, a 5-year-old with a blowtorch going around your sitting room, and they need to be mopped up by glutathione and vitamin C. So you don't really want to have extra problems that you have to mop up when these are already products of your body's own breakdown and build up situation. And so the demonization of fat really has caused a large amounts of problems with people's mental health, because the brain is 50% saturated fat and your nervous system is 60% saturated fat. And for example, one of the things that children need is fat, and fat, saturated fat. And we all need it too. And people have talked in the course of these 3 days about carbohydrates and saturated fat. And certainly when you replace all your requirements with carbohydrates, you force your pancreas to produce excessive amounts of insulin, which make you fat because they lower your blood sugar level by turning it into fat. So they exhaust your pancreas, they make you insulin resistant, and they lead to diabetes and dementia. It's not the only reason that everybody's diabetic now, and it's not the only reason that everyone's demented. Well, generalizing, but it's certainly one of the problems. And when you look at ancient cultures or look at an old book, like, for example, the Bible, one of the ways it praises a place is it talks about the fat of the land. This is not an insult, because they knew that fat was the best bit. In the 1920s, 30s, children went to school with dripping on their piece of bread if they were lucky, because it meant their parents had had a joint. They'd never throw that away. I can't believe nowadays that people throw all the fat away when it has all those very important nutritional factors, and it's saturated and it's good for your brain and it's good for your growing children's brain. And of course, then everybody was given margarine, which doesn't exist in nature and is quite poisonous. So omega-3s are very important. And if you've got somebody with a mental health problem, you need to supplement them. There's all sorts of different ways. And the other thing is, because the gut health makes a big difference, and BioCare do a product called MindLinks, which has particularly chosen probiotics with L-glutamine, which partly heals the gut. And the gut's a big gateway towards your to brain and overall health. So that's a product you can use, but also you can make your own sauerkraut, you can make kombucha, you can use miso. I've never had any success with kombucha. I can make sauerkraut. And miso, of course, is a very good way of getting available amino acids. So another avenue towards this is homeopathy. So I have quite a few patients who have had very difficult mental health problems and mental health problems with their children, and homeopathic constitutional treatment, along with the overall maintenance, the setup, is very important. And there are different sorts of homeopathic remedies that you can use at different stages. However, the most important thing that you need to clear, or the most important part, I think, are the miasms. Okay, so there's 3 different levels of homeopathy. There's acute, so you bang your head and you take arnica, and it doesn't matter what you're like, because the bang is overshadowing your personality and your constitution. Then there's constitutional levels, which is what you're like. Do you like being alone when you're sad? Do you like salt? Are you upset by eating fatty foods? Are you jealous? Whatever. Talkative, silent. Then there's a deeper level called miasms, which are what you inherit from your parents, and what one of the attenders of my lectures very nicely described as karma, the homeopathic karma, okay, the karma remedies. It really is karma. And there's far fewer of these. And some of them are named after venereal diseases, which doesn't mean that your parents had these things, because these physical manifestations are only the outward appearance of what's happening inside. And certain diseases were part of the zeitgeist, the spirit of the time of certain centuries. There's the TB century, there's the AIDS century, there's the syphilis century. So when these ideas were formulated, there was we didn't know about heredity in the genes, because the monk Mendel hadn't done his experiments on the peas, and he was very lucky that he actually used those, because most things are not dominant and recessive, they're mostly multifactorial. And as we've gone through time, we now think that once we know the human genome, we can decide everything and manipulate everything. We can tell you that you're going to have a heart attack at the age of 37, which I think is no great bonus to know. But the fact is, we share about 70% of our genes with a fruit fly. So how can the genes determine what we are? And we actually know that it's not the genes, it's whether they're switched on or not, which is all about the environment. And what stopped people dying from the 19th to the 20th century was cleaning up the environment. The Victorians saw that people who died a lot were generally ugly, lived in smelly, horrible places that looked bad, and they started walling in the sewers. The great Edwin Chadwick was the great man who initiated all of these, but sometimes it took 80 years and after his death for things to actually happen. And that's why everybody stopped dying. So they thought it was all environment, and that's why they made hospitals that look pretty, and they put them in pretty grounds, because they thought that would lift people's spirits. And that's one of the things we lost a lot in medicine. We lost the whole idea of the spirit and the soul, and the things that feed the spirit and the soul, like greenery and being able to see the sky and having a window that's open and fresh air and so on. So then the genes came along, and we were told it's all about that. But then we know it's not, because as I said, it's whether they're switched on or not. So now we have this field called epigenetics, which all the Greek speakers will know means on top of genetics. which is actually just environment. But if you call it environment, you lose all the funding to your genetics department. So you have to leave genetics in the name. So the way I see the miasms, I see the miasms as having an epigenetic effect. As well as that, it goes back and heals some of your ancestral sins, whatever they are. They might not be sins in terms of what's in the Bible, but they are maybe mistakes in living. So and you can see in when you look at these. So this is a representation. I'm a very visual person. That's why I've had lots of pictures on the slides. This is called psora, P-S-O-R-A, which in Greek means itch. It's also related to tsara'at, the Hebrew, for which, if you pronounce it the Ashkenazi way, is saras, which is related to leprosy in the Bible. And Hahnemann said that this is all about lack and fear. So this is the person who's cold, turned off, fearful, and it comes down through the family history. And Hahnemann thought that everybody had this. This is not the one I find as the most useful miasm, but I'll mention it because it's supposed to be the universal miasm. And interestingly, in the Greek scriptures, in the Hebrew scriptures, when we talk about leprosy, the rabbis in the commentaries say it wasn't anything to do with a skin disease. It was actually an internal disease that was caused by the sin of speaking badly about your neighbor. And the only reason it appeared on the skin is because people were so much more pure in those days. You could see their sins on their skin, as opposed to the way we hide them away now. And we can't be seen. So we don't any longer wear our hearts on our sleeve. So the whole thing about this psora, tsara'at was about lack. There is one that I see more in mental health disease, which is the medarinum. And this is the one that is allied to the venereal disease gonorrhea, which is all about discharges, and it's all about excess. So this is how it was quite hard with the things I have in my head, trying to make a picture of what it would look like. So it's sort of gloopy. The people have shiny, oily skin. They might, if you look at the characteristic of the person as opposed to what's in their family history, they might have warts and excrescences, people with those things that you see on the, when you're traveling sometimes, and people have these great big things growing on their noses. If they have heart disease, it's not sort of heart attack heart disease, it's mushy heart failure, all that fluid heart disease. If they have arthritis, it's not erosive arthritis, it's that boggy, squidgy arthritis that you can hear squidging when it moves. These people have often histories of repeated miscarriages. They might have ovarian cysts, more excess, cysts full of fluid, the cysts that mean that you can't produce eggs, and repeated blocked tubes, and all sorts of, as I said, excessive things. And they're influenced by the full moon, because we know what the full moon does to water. It pulls it around all over the earth, and they're influenced by it. So that sort of wet depression, where you're just wallowing in a mud like this, of being unable to move here, there, or anywhere, that sort of, as I said, not quicksand, but like a swamp that would swallow you type of depression. It's also associated with other sorts of excess, like excessive need to accumulate things, accumulate possessions, accumulate wealth, accumulate money. You sometimes find it in the refugee mentality, where the knock on the door came, and if you hadn't had that crust of bread on the 5-day journey up to Auschwitz, you would never have managed to survive if you were one of the lucky ones who did survive. So it's all about excess. So it's called psychosis, not like the psychosis. It's from the Greek psycho, which is a fig, and the type of growths you got with gonorrhea were called figworts, because they looked a little bit like figs, and figs are squidgy as well. Now, the one that I find majors and really needs to be cleared in people who are presenting with this type of, with any type of depression, psychosis, whatever, and it comes up lots and lots and lots to me, is this one, which is syphilinum. Okay, so it doesn't mean your relatives or your ancestors had syphilinum. If you have syphilis, the disease, it starts off with erosion of your mucous membrane, and that might heal up. And then over time, it starts eroding other things, even though you can't see it. It starts eroding the blood vessels, and it starts eroding the bones, and all the pains are worse at night. See, fiery pains worse at night, but here's the dark, nasty dungeon, whatever it is, erosive. And then as time goes by, it might be 20 years later, it affects, before that, it affects your nerves, but eventually it can make you go insane. It's called GPI, general paralysis of the insane. And as I said, this was the zeitgeist a lot in the 19th century, when all these great writers like Nietzsche, Guy de Maupassant, artists like Van Gogh, who chopped his ear off, many of them had syphilis, and they wrote and produced some of their best works of art before they went over the edge. And I think that's one of the reasons why there's this saying, there's a hair's breadth between genius and insanity. And when you look at the family history, there's a clear family history. You will find there are self-destructive occasions in your family history: road traffic accidents, fractures, head injuries, addictions, alcoholism, eating disorders, suicide. So this isn't the person who wallows in the depression. This is the person who kills themselves. You know, they don't all do it, but I'm saying you'll have it in the family history, although sometimes it's more difficult to find it when you look further back. When you look at whole religions or races of people who've been slaughtered, the whole idea of this is erosion and self-destruction. And so if you break your leg, heaven forbid, you, as well as taking something to knit for the bruising and knitting the bone, you would take syphilinum for being so self-destructive as to break your leg. And you might say, well, but it wasn't me, it was raining and the truck driver was drunk and there was oil on the road, etc. But from a homeopathic point of view, you attracted it, because why was it you and not the person before you and the person after you? So when you see this in the family history and some of the games that people play, because electronic digital things are really one of the things that don't help your mental health. If you are that type of person, it pushes you into these things. A lot of what they play looks like this. It's full of violence and destruction and whatever. And one of the things I find hopeful about the whole managing people by clearing their homeopathic miasms is that there's an idea that, you know, time is not in a straight line. It's circular. And so we're here and the Romans are here and the dinosaurs are here. Oh, sorry. Let me just get rid of this. Sorry. Sorry, I can't stop my without turning off the internet. I can't stop internet calls. Yes. So what was I saying? Yeah. So there's an idea in homeopathic philosophy that when you take these to clear your ancestral influences, you actually go back and heal your ancestors from their influence. And really, if you think about it, that's the only way you'd be born without it. So if you've got any of these things in your family history, you need to clear them anyway. And if you've got any type of mental health problem, it's really important that you do that. And one of the things with syphilinum, which some people write on a prescription as lueticum, because they are of the type of people who don't like explaining to their patients or clients exactly about what the remedy is about, because they think it will put them off. Whereas I think it's so important, because the symbolicism or the symbolic importance of the remedy is what starts your own symbolic part of your brain hearing what's happening and starting to fix itself. So one of the most important things about syphilinum is that this is the equinox, is that you never take it after the September equinox. You wait till the spring, because everything about syphilinum is worse at night. And so you don't want to be taking it unless it's really, there's some enormous kind of emergency. You don't want to take it when the nights are getting longer. You take it when the time, the day is opening out. And I just mentioned yesterday the important things of whatever you're doing, which is, making sure you've got fresh air, the window open, you have a hot drink with something bitter to get your liver cleansing. You make sure you drink enough fluids, really important for your kidney, and the Epsom salt baths to help pull stuff out of your skin, which is another organ of excretion. And then I saw this rather nice picture, which was talking about mental health, where it was talking about what's really important is healthy sleep, oxygen, that's the window open, pure water, mental exercises. Apart from that, Sudoku. It will probably come back to haunt me, but there's all these Japanese studies that show that if you play Sudoku, you don't get demented. And I just sort of think to myself, I think I'd prefer to get demented than play Sudoku. Healthy food, sport, or walking around the park and chatting to people, get a dog, and all the right sorts of fruit and vegetables and so on. So thank you very much. And I'll hand back to Sally now, who will open the floor for questioning.
Jayne, thank you so much for that. That was really interesting. One question I wanted to ask, I mean, you were talking about vitamin D and mental health.
Yes.
When we think of vitamin D, that it's the building blocks for your immune system. Yes. So why does it work with mental health?
I don't know, apart from your mental health is part of your immune system. I mean, the immune system has to have a happy body. If you look at, so actually I do know, there are lots and lots of studies which show that when you're miserable and upset or stressed, And stress is good. It's what keeps you going and keeps your brain functioning. But excessive stress that goes on and on, first of all, it makes you produce your stress response, which is your steroid hormones and adrenaline. But then when it carries on and on and on, and you haven't run away from the saber-toothed tiger because there wasn't one, and you haven't killed it because there wasn't one, and you're still in this same situation, what you do is you exhaust your adrenals, and they get worn out. And when your adrenals aren't working, you don't feel perky, you don't feel happy, you don't feel hopeful. So your immune system goes down. So when your immune system is down, it's a sign that really your adrenals aren't working very well. And so it's all part of overall health. So this is the thing about, it's not in your brain and it's not in your gut. It's in the whole lot of you.
Why does niacin work? Vitamin B3. I mean, what is that vitamin for?
Well, empirically, it works. And in many situations, being a homeopath with giving people remedies that from a pharmacological point of view don't have anything in them, I'm not so fussed about how they work, but the fact that they work in the situations when they do, and they don't cause problems, and they're not that expensive, and you can get along really quite well yourself. Other people like to go into these things more, and Dr. Hoffer did indeed go into these things more, and he said that one of the breakdown products of adrenaline, which is adrenochrome, which has quite a lot of publicity recently, if there is not enough niacin, this pathway doesn't work in terms of being broken down, and it's a psychoactive substance, and so it can make you more vulnerable to having all sorts of things that you get with, for example, something like schizophrenia, where you get hallucinations, whether they're visual or auditory. And certainly people who take niacin, some people say it makes their skin very good in terms of acne, but a lot of them say it relaxes them, it makes them be able to sleep better. And for some people, as I said, they particularly ones who've had serious mental health problems, and he's taken people who were basically crippled with their problems and would have been institutionalized for years, and he's got them out of those or avoided them going into those places. So that's quite impressive. And it doesn't seem to have toxicity. Some people say you can get liver toxicity, but then there aren't any studies showing that people die from taking it. And as he pointed out, you could say water's toxic because people drown in it. It depends on how you use these things. And there is, and the body also tells you if you've taken too much niacin, because it makes you feel nauseated.
And what do you think comes first? Is it the vitamin deficiency, or is it the psychological problems? What is it? Are we in a catch-22? What causes what?
Well, as we know, there was a vitamin deficiency called pellagra, which was very common in the United States, particularly in the southern United States, among poor Black people who didn't have much in their diet apart from sometimes just rice, because if you have white polished rice and you eat other things that like meat and properly balanced legumes and so on, you could make up for the fact that maybe it doesn't have any of the B vitamins on its casing anymore. But they had this thing called pellagra, which is the pel bit to do with your skin. They had this uncomfortable skin condition, but they all had they went mad, and the institutions were full of mad people with pellagra. They called them pellagrins, and no one had any idea that it was anything other than an unfortunate thing that happened. And then they found out it was due to niacin or vitamin B3 deficiency, and these people were just emptied out of the institutions. So he thought there were one lot of people who were the pellagrins who, due to their diet, didn't have enough. But he thought that actually schizophrenia itself was a form of pellagra that you were genetically slightly more susceptible to, because he noticed other characteristics in people who had schizophrenia, and he used to tell them these things because, as far as people with mental health problems are concerned, they're just scum, there's stigma, and there was nothing redemptory about it. But he noticed, and other people have noticed actually, that people who are in families where there is a tendency to some kind of psychosis, which could be schizophrenia or what we call bipolar, where you oscillate between being completely down and being completely manic. Sometimes people only notice the manic part. These people often age well. They don't wrinkle so much. Their hair keeps their color, and they have less heart disease. So in the relatives of the people who don't suffer, and in the people themselves, they have better health in other conditions, a bit like sickle cell disease, you know, where you have people who have 2 doses of the sickle cell and they can be crippled. But on the other hand, if you just have 1 dose of it, you're protected from malaria.
Yeah, this is something that's come up recently and obviously relevant to us being here. The other thing I was going to ask is, you know, there's a huge argument over fats at the moment.
Yes.
So people who don't want to eat animal fats, is coconut oil their best option? What's the best option?
I was about to say, people who don't want to eat animal fats can eat coconut oil, which is another terrible saturated oil that you shouldn't have any of. So coconut oil is great oil. It's saturated. It's safe to cook with. It's got medium chain triglycerides, which are very good for your thyroid. And a lot of people have got thyroid problems. They just sit there doing nothing very much, partly in some cases in northern hemisphere, because they have all their windows closed and they never allow the house to get a bit cold, which you need to wake up your thyroid. And in hotter climes where if you work in the heat, your thyroid will keep going. But if you've got lots of other people to work for you, you have the pictures of sort of the lotus eaters just lying around getting fatter and fatter as their thyroid turns off more and more, because it doesn't need to either keep them warm because of the ambient temperature, and they don't need to do any work.
And do you, there's a book in the US, I think, which is a log of mental health diseases, as they like to be called.
Oh, the DSM-4 or DSM, whatever its iteration is now. That
started out that, and it's now that. But I just wonder if we are heading into a period of time where the teenage years are going to be diagnosed as a mental health issue. Because obviously today is all about children, teenagers and young people. And we know it's a difficult time for all those groups. Forget what's going on at the moment.
It is a difficult time anyway. And certainly in terms of grit, it seems to me that the people born from the 90s and the 2000s onwards, people talk about the snowflake generation. They have an awful lot of adult power. You know, they have spending power. They can have their own TV and their own computer and their own phone, and they can be in contact with people all over the place. But they don't seem to have the grit or resilience because even if they're poor and they don't have a good diet, they're still able to stuff themselves up with all this low nutrient waste thing, and they have no responsibility. You know, there's many children who never lay a table, they never wash up, and they're not allowed to walk to school on their own because they might get kidnapped, and everything is hemmed in. So they have this enormous power, but then they don't have the power that a child in the 1950s would have to run out of the door in the morning in the summer, excuse me, in the holiday, which used to be about 6 to 8 weeks as opposed to 4.5 weeks now in the UK, unlike in countries like America that have proper length summer holidays. They'd run off and they wouldn't come back till the evening, and no one would worry about them. And as a child myself, I used to play on building sites, hanging up bits of scaffolding, playing around in sites that hadn't been cleared up since they were bombed in the war, you know, and no one cared about that. Whereas we don't, and things you might bang yourself or cut yourself. They've even got rid of all the paddling pools they used to have in all the parks, because a child might fall over and then their parent will sue the park. So they have so little outlet, they don't have resilience. And so if you don't have resilience and you're being fed more and more degraded diets, you'll have more mental health problems. And in fact, the great Weston Price, who wrote his fantastic book, I don't know where it is over there. Oh yes, it's Nutrition and Physical Degeneration. I had it for about 8 years before I actually read it. There are wonderful books from the Weston Price Foundation, but the one that was actually written by him is the best one. And he was very diligent. He was a dentist. He saw how people's teeth degraded. He looked at the diet we now had, where we've got white flour, white sugar, dried egg and all these things. And he went with his very devoted wife all over the world looking at primitive people, so-called primitive, we call them primitive, who lived to 100. They didn't have heart disease. You know, they could run 250 miles with no shoes on, whatever. They weren't all meat eaters. Some of them were up Swiss valleys where they ate cheese and milk from cows that ate fast-growing grass in the spring. And he, unlike other people in the 30s, where the big eugenics movement was going on in the United States, which is what Hitler learned from, he saw people were being picked on and ridiculed and institutionalized because of their aberrant behavior, because you could see they were going to be aberrant because you know, they had the thing about physiognomy, what their face looked like, how big their chin was, how big their forehead was. And he said, unusually, this is really wrong. There are all these people who are being, and youths and adolescents who are being blamed for being deviant and put in institutions, when what we're doing is we're feeding them this denatured diet. And that is why they're behaving like this, because they don't have the wherewithal they need for life. They haven't got proper fats, they haven't got proper foods, and you don't have to be a meat eater. You can do very well as a vegetarian. I do think it's very difficult to do it as a vegan. Vegan's a great detox, but I'm not one of the people who think it's sustainable long term, although lots of people disagree with me. And he was so enlightened. Instead of saying all these, you know, people, black people, white trash, you know, they should all be eliminated or got rid of or put in holding pens, he said, no, we're making them like that. And he tracked this degeneration from people at Inuit trading posts, where, you know, the first 6 children would have big jaws with large teeth and nice wide cheekbones. And he identified the size of your jaw is usually proportional to the size of your pelvis. And then as they started eating the denatured diet, their jaws would get small and their faces would come in and their teeth would get overcrowded. The pelvises would be smaller. They'd be more susceptible to TB and rickets because of the low fat diet, the rickets, and they'd all be dying in childbirth. So
I think we are just about to go to our next speaker. I wonder if Sarah Waters and Dr. Zenobia Storer want to just very quickly unmute themselves, and if they have questions for Jayne very quickly, because they were both our psychologists who spoke this morning. So it might be interesting, you know, just for there to be a question each to you on diet and mental health in children and young adults and teenagers.
Yeah, I mean, just a comment really, it's absolutely fascinating, Jayne. I really enjoyed that. And actually, one of the things which I find most difficult working in therapy with young people is establishing the building blocks on which you can then do this, you know, because obviously they come and you're supposed to be doing whatever you're doing, CBT with them or something more exploratory. But to get young people to engage with a basic program around sleeping properly, eating properly, I find that really difficult, with the most troublesome one, the ones who are most, troubled in various ways, that they kind of upside down lives that so many depressed young people lead. You know, they're just, it's no wonder they're depressed. You don't even need to be, they're coming along and they're wanting to engage in therapy, but don't seem to understand that actually if you're not sleeping, you're not eating properly. But a lot of this stuff, I'm aware of the basics of, what is a conventional idea of a decent diet, and without the knowledge that you have, and I'm absolutely fascinated to understand more about the particular nutritional elements that might help young people, but also about how to motivate them too to engage in that aspect of their mental well-being. I just wonder whether you've had experience of kind of success in engaging young people in those sorts of changes to their basic lifestyle that make a massive difference to mental health.
Well, the sort of people that you see, or the ones that withdraw so much they don't see anybody, the people who have saved their lives and their mental health are their parents, because they don't have the motivation and they don't even want these changes, and they are often addicted to the things that give them sugar highs or whatever. And I've one particular young man who just disappeared. He'd been doing very well, and then he was slightly on the autistic spectrum, and he just crashed. And his mother, faithfully every single day, one of the things he will do is he will take food in and he'll take the water in, and she puts rescue remedy in the water and a pinch of salt in the water, and they're always sitting there, and she makes him what he likes, his roast dinners. So he's getting decent vegetables, decent meat, decent gravy, decent whatever. You might say that's not the Mediterranean diet, but he's getting a decent diet, even though he won't open any of the windows. And it's taken about it's taken over a year, 18 months, and he's just starting to come out of it. But if he wasn't doing that, it was his mother who made sure that those things were there, and that when he came out of his room, when she and his sister weren't in the house, that there were nutritious things that he could get from the store cupboard and whatever, because she couldn't get to him. So how you would manage sitting in an office with somebody to try and get them to do that, I don't know.
So it's working with parents, obviously. So presumably that's where you reach out, must be the best thing to talk to parents. Yeah. What was have you got a, I haven't seen the conference stuff yet. Have you got a website with some recommendations about books around nutrition, particularly for teenagers? Or?
I have got a website which doesn't really concentrate on that, but I've got a resource that's coming out which will be able to be sent out.
Okay, thank you.
Thank you for your question.
And Sarah, did you want to ask a question?
Yes, I would. I mean, what I think would be fantastic is like what you're planning with regards to this health village, really, but where there is a sort of a team of people around young people who can each sort of give individual sort of like bits of advice. I mean, that's what I sort of come up against, really. I try to encourage parents to perhaps take their young people to a homeopath or a kinesiologist to get to get their levels tested and all of that sort of thing, and to get really sort of more targeted advice around the sort of stuff that Jayne's talking about. But a lot of them, I mean, there's a sort of financial implication to that, of course, isn't there? Because a lot of them are sort of maybe paying to come and see me. So, yeah, I just think having somebody to be able to sort of refer them to, it's something that I do talk about, definitely talk about gut health a lot, because I very much am on that tip as well and find it all very fascinating. But I think people often just sort of look at me as if I'm a bit mad and they're not really quite there yet. It's like, thinking about the fact that your gut is going to affect your brain. So I think it's just getting over that sort of barrier with people, really. But again, I'm just trying to think whether there's some sort of a book or a handout or something that could be given to these parents to sort of explain all of this better would be really great.
Well, thank you for pointing that out. Yes, that's very true. But that's why I was saying I have to work in partnership with people, because some of these things you have to edge along and there's no hard and fast answer. So a very good book about for guts is The Gut Book by Julia Enders, which I'm sending with the resources. There's a psychiatry book. So people read the psychiatry book. He gives doses. He tells you things. So people can start deciding, I will try that myself. Or they'll say, so that's not seeing another specialist. That's maybe getting back to me and saying, well, this is what I've decided to do. What do you think of that? And I say, whatever. And it can be part of the, say, homeopathic follow-up. And of course, there's the Gut and Psychology Syndrome book by Dr. Natasha Campbell McBride. And there comes a point where people with all health, particularly new health, we have to take back our own power, which might mean reading some books and trying some stuff out ourselves. But you can get these things, you can get the nutrients online. You don't need a prescription for them. You can start off with a low dose. You can see it bit by bit. There are cases, it must be said, which cause ethical problems. Well, not actually to me, I think. What else can you do? Where people have to put these things in the people's food so they don't notice they're having them. But if you're giving something like a homeopathic remedy, which doesn't have anything pharmacological in it, or a supplement, well, where's the harm in that when the person's stuck inside? And if they were in a hospital, they might be there under section, stuck in a room. One particular patient's daughter who went to one of those, she had phobias like lots of people do about filth and whatever, and the loo next to her was cracked yellow, had fungus growing around it. I mean, and the people who were running the ward, as I noticed from when I was a student, it's hard to distinguish between who's the patient and who's the psychiatrist.
On that note, Jayne, what I've always loved about Jayne is her sarcasm. I think she's the only person who can match me. We obviously, the sarcastic kids in the class, I think. Sarah Duff has joined us. She's our next speaker. So I think we'll just have a 10-minute break because we're running a bit behind. Sarah's walking in Camino, but she is going to talk about how she's been working in schools with very young children who have had half their life with pandemic measures, and she's reaching them through play. So I'm really, really looking forward to that talk. Let's just have a 10-minute break and come back to Sarah Duff at past. Thanks very much, Jayne.
A pleasure.